our highest daily death toll by far. At the start of another week in lockdown, today's health briefing revealed a large jump in fatalities from COVID-19 in Ireland.
We've been notified today of 77 additional deaths, bringing the total number to 687 notified. 67 of those additional ones are in the east, 4 in the west, 4 in the northwest and 2 in the south. 31 males, 42 females. It doesn't quite add up. We haven't had notification of in 4 of the cases. The median age is 84, and in 54 of the 77 we have reports of an underlying medical condition.
It comes as the Taoiseach today addressed questions on how Ireland might begin to ease lockdown restrictions. Speaking at the Dublin Civil Defence headquarters while paying tribute to volunteers, Leo Varadkar said the country would have to reopen on a phased basis.
And I'd prefer not to raise hopes or raise expectations, only to dash them. So we're working on, as you may have seen published in other countries, is, if you like, a stepwise plan whereby we could start to reopen certain services, certain parts of the economy, and then review it every 2 to 3 weeks.
Well, today the Health Minister warned that complacency could be disastrous in the battle against COVID-19. Speaking to Virgin Media News, Simon Harris said any progress made by the Irish public could be very easily reversed.
But we're not there yet, and we shouldn't start presuming that we are, or presuming that the trend that we're on will continue. If we eased up now, if an air of complacency set in now, and people thought, yeah, we're doing all right in Ireland now, we've made a bit of progress, that can be an extremely dangerous position to be in.
Well, the Cabinet subcommittee today met to discuss travel restrictions at ports and airports. It follows recent controversy over the arrival of fruit pickers from Bulgaria planning to work in Ireland. A statement released this evening said the subcommittee discussed options to tighten travel restrictions at ports and airports. These will now be discussed further with Cabinet and with the administration in Northern Ireland before a final decision is made. Tonight, as the families of 77 more people mourn their loved ones and hundreds more deal with contracting the virus, experts have warned that we could be facing several further waves of COVID-19. Caroline Tuhig, Virgin Media News.
Well, our reporter Zara King is at the Department of Health for us tonight, and another tragic day, Zara, with a record number of lives lost to COVID-19.
Yes, Claire, I suppose 77 is a very shocking statistic for everyone to learn of today, not least for the families of those individuals who will be coming to terms with the reality of COVID-19 coming direct to them in their homes, this global pandemic affecting them directly. Behind those statistics, their grandmothers, grandfathers, mothers and fathers, brothers and sisters, real people who have lost their lives to COVID-19. In relation to a breakdown of those 77 deaths that we have learned about today, 67 of those people were based in the east, 4 in the west, 4 in the northwest and 2 in the south. Among them were 32 males, 44 females and 1 whose gender was not specified. Also, we have learned today that 54 of those had underlying health conditions. It brings the death toll here in Ireland of COVID-19 now to 687. An absolutely devastating day for all of those families. The Chief Medical Officer, Tony Houlihan, once again expressing his deepest condolences to the families at the centre of this. And Claire, it is important for people to recognise that while we are reporting 77 deaths today, this is the deaths we've been notified of. It's important to note that these didn't necessarily happen in the last 24 hours. They may have happened over the last couple of days or weeks, and the data in relation to that has been inputted into the system, as the Chief Medical Officer now explains.
That there is essentially the equivalent of what I would have, the number of deaths overall for all deaths notified to us. I've just put the last few in red because I want to make the point again that there's a lag time. So you can't be certain that that's the total for those days. There may well have been people who died in those days where just the process of getting notified and getting updated and so on hasn't been complete for those days. So don't conclude that that's a drop-off.
Well, Claire, we know that the National Public Health Emergency Team will meet tomorrow for their weekly meeting, and they're due to discuss travel restrictions, to review those travel restrictions. They'll also speak about the easing of restrictions, and also we're hoping to at last get an update in relation to childcare for frontline healthcare workers.
Zara, thank you. And if you are concerned about coronavirus, you can also get more information from the HSE.